Hello and welcome to another English podcast with Paul. I'm your host, Paul, and this is
Kate.
Excellent. Thank you very much for being here. Thank you very much for participating.
You're welcome.
And as I said, this is unscripted and unedited. I have a few questions here, make it look a bit professional. So, Kate, what is your occupation? What do you do for a living?
I am a paramedic.
Paramedic.
With the ambulance
that sounds
service.
exciting. That sounds exciting.
Yeah.
Kate, my viewers that do watch, they might think that you're quite young. Can I ask, how old are you?
I'm 24.
24, wow.
Yeah.
Okay. Yeah. And how did you get into being a paramedic?
So I always wanted to do something medical throughout my life, pretty much. I come from quite a medical family on my mum's side, and so I always wanted to do something within that field, but I wasn't quite sure. Then I decided that it was going to be out of midwifery or paramedicine, and I chose paramedicine for the kind of variation in the job, and you do a lot more than just staying in four walls of a hospital. So I did that, and then as a result of that, I had to get a degree in paramedicine, and here we are
a degree.
now. Yeah.
Goodness. Okay.
Yeah.
So you said that you wanted to do something in the family. So what do your family do then?
So my mum was a nurse. Her father was a GP, like a doctor.
Oh, wow.
Her mother was a midwife. My great-grandparents, one was a doctor and the other one was a nurse.
So you might say that medical care is in your blood.
Maybe. I think so.
Okay,
Yeah.
okay.
Yeah.
All right. And you said that you're passionate about it. What is it you love about it?
I love the variation of the role. You never, ever know what you're going to go to on your next shift, the shift you're on, or even next job. I love the variation. I love all kinds of people, different kinds of people you meet. You meet everything. You know, I've been to jobs where one job I've delivered a baby, and literally the next job, 40 minutes later, I've been to a 101-year-old. I love that. I love not knowing what you're going to go to, who you're going to see, if it's going to be make you have a bit of adrenaline rush, or if it's just going to be a run-of-the-mill job. And that's what I love. That is what I love about it.
I'm still thinking about you delivering a baby. What's that like?
It's amazing. It's such a special feeling. There's no words really to describe it. It's so special. It's a bit chaotic. It can be chaotic, especially as paramedics delivering a baby in the community or in someone's house.
So you might not have done this. Oh, so you might have done this in somebody's house.
Yeah, this is all in someone's house.
Wow.
Yeah, or wherever,
okay,
in a car park, in a car, on the side of a road.
Really?
So we don't have the kind of the ease of maybe a hospital and good lighting and good whatever. We have what we have and our kit and our equipment, and that is about it. That's it.
Oh,
really.
that does sound scary.
So it can be really scary, but it also can be really brilliant.
Yeah.
So, but the scary bits, you have to kind of think on your feet a bit, and yeah.
And what would you say is the most challenging part of being a paramedic?
Some might say shift work. So we do 12-hour shifts, and they are
grueling.
anything. Yeah. So we get to work about 15 minutes before our shift starts. And then if they overrun, if you get a late job or something, they can be anything longer than that. Within 12 hours, we have a 30-minute break that's
just
timed.
30 minutes?
And that's it. So some might say that. And those shifts can be anything. So some are day, some are night, some are twilight shifts where you do lunchtime till midnight, something like that. The other thing I find challenging is probably misuse of the ambulance service. I find it frustrating when people misuse the ambulance service.
So somebody might ring up and say they've got a broken nail or a splinter.
Yeah. I've been to some. You know, I've got literally that, or whatever, or a small graze on my knee or something. I find that quite infuriating, and I find it challenging when you spend your time going to them, and then you go to somebody. Your next call or your next job is a lady who's been on the floor for 18 hours or something, and you're thinking, why they have to wait and they get prioritised lower for a wound.
So how do you disconnect your emotion? You know, especially if it's something very sensitive, like maybe a child or somebody that's seriously injured. How do you disconnect?
I think it's a bit of a skill. And probably others would say we wouldn't be who we are at work if it was our family. So
Okay,
I think the way
okay.
we do it is that we can be kind of quite composed when we don't know the person. It does make it tricky when you then have finished your job and the adrenaline's gone or whatever, and you do think, actually, they're a human, they have a family, you know, whatever, they were children once, you know, whatever. That's a bit tricky, but it's disassociating that they're not your family. You've also done everything in your powers to help them. You've done nothing that, like, it's called beneficence and non-maleficence, is doing best for the patient and doing right for the patient and things like that.
Yeah.
So you just have to basically go away, and even if it's not the outcome you wanted, you know that you have done everything that you could have done for that patient and for therefore then that patient's family. And that kind of makes you feel better.
All right, okay, that makes sense. That makes sense.
Yeah.
Is there some kind of counselling if you do struggle with the?
Yes.
Okay,
So
that's good.
at work there's wellbeing services. You can go to operations managers, you can go up, there's like counselling, because obviously it's NHS, so that there's NHS services available.
Yeah.
Counselling, like you say.
Well, but would you get more priority, because some of the services are under a lot of pressure, and if you needed counselling to get back into your work, then you wouldn't want to be on a waiting list for 6 months.
Yeah, no, so rather than it being kind of NHS counselling, it's within the service. So it's prioritised just for paramedics and ambulance technicians and people who work there. So you kind of have a bit of a fast track.
Okay, that's a good idea. That's good. All right. If you could change anything about your role, what would it be?
That's a really tricky one.
Now, I'd be thinking the paperwork. The paperwork must be tricky.
It would probably, yeah, absolutely. Paperwork is very important, and, well, it's very important because litigation is such a big thing. If I could do less paperwork and help more patients, that would be the thing I'd probably change. We have to document absolutely everything, as do all healthcare roles. Nurses have to do the same, midwives, everybody, doctors have to write notes.
You say write notes. Do you physically have to write them down, or is it all digitalised?
The trust that I was with is all digital. I think there is one trust left in the country where it's on paper, and it's a big A3 piece of paper, and you literally fill in the boxes. Mine is all on an iPad, and you, it's a special app that's you fill everything in. You have all the patient's details, you know, on there as well, and that's what we fill in.
Are you doing it after you've spent time, or whilst you're with them?
Well, some of it's with the patient. For example, like the real kind of pertinent stuff, next of kin, that kind of thing, their current medication, their past medical history. And then if it's a short conveyance to hospital, you won't get much done. If it's a long conveyance...
so conveyance is travel to hospital?
Yeah, absolutely.
Okay,
so
right.
some of us, sometimes if we go quite rural, we can have a 25-minute drive to hospital, which would be a long conveyance. So in that time, you can get quite a lot of paperwork done.
Okay.
If you're in the middle of a city centre, like you're in the middle of Birmingham or the middle of London or Manchester, your conveyance to hospital, I think in London, you're no more than 7 minutes from a hospital.
Really?
So you have more time.
So how many hospitals are there in London?
I don't know. I do not know, I'm afraid. Quite a lot. Not all receive emergency ambulances, but you are quite close to them, so then obviously you would do the paperwork afterwards.
Yeah. All right, okay. All right, moving on. If you didn't do this role, what would you do?
If I didn't do this and I did one within medicine, I would do midwifery.
Okay.
Potentially would think about going back to uni and doing medicine, possibly. If I did something entirely different, not down the medicine route, I would... Oh, I don't know. I'd find that really tough.
You don't
know? No.
But you like sport so much. You told me earlier you like sport.
Yeah, I would probably do something potentially to do with horses, maybe, even though I said I wouldn't. I wanted to be a jockey, so like a racehorse rider. When I was younger, maybe I'd go into that, maybe not.
Okay.
But I think I'd struggle not to do something within the NHS or medical.
So you seem to have a real connection with people.
Yeah, I love people. I think that's kind of the reason why I do it. Absolutely. Yeah.
All right.
Yeah.
Can I ask, would you recommend this to somebody young? Well, I mean, obviously, you're fairly young yourself.
Yes, I would recommend it to someone, but not at 18. I would say go and get a little bit of life experience before you do
Okay,
it.
okay. And why is that? Is that because it's challenging dealing with older people?
I think it's learning a little bit about just life in general, learning how to talk to people, how to interact with people. You know, you can go to so many different. Well, you go to anyone from, like I say, 0 to 101. You go to very mentally unstable people. You go to people in a crisis. Learning how to deal with that so you're not freaked out by it, and also some of the things we see are lovely and great and absolutely fine. Some of the things you see are a bit nasty, and I think I certainly would have struggled if I did it at 18.
Okay, well, that's fair enough. That's fair
And
comment.
just like with that age thing, again, 12-hour shifts when you're that age, you want to go and have a little bit of fun maybe before you have
that makes sense.
a lot of hours in a week of quite thoughtful things. So I would, yes, recommend
a lot of
it to young.
seriousness, I'd imagine.
Yeah, there's a lot of seriousness. Yes, I'd recommend it to somebody who's young, 100%.
So what should they think about in regards to the choices they make for education, like GCSEs and A-levels? What kind of A-levels would they be looking towards?
So to do paramedicine or I think any other medical degree, pretty much you need to have at least one science at A-level. I did 2 or 3 sciences at A-level, 2 and 1 AS. But I didn't choose my A-levels for what I wanted to do. I didn't know really what I wanted to do fully. I knew I wanted to do something medical, but I was never entirely sure. So I chose very broad A-levels, a couple of sciences. What else did I do? I'm trying to think. Humanities, things like that. And then GCSEs, I did all the normal ones, plus RS and
what is RS?
Religious education, so religious studies.
Okay.
And I also did a language because it just
think-
looks a bit better I think it looks a bit better having a language as well.
Yeah, for sure. Yeah, it really opened up your mind. Do you think the religious studies helped with being in the community of a diverse community?
I think certainly working in a city, so working in Birmingham, it's the most like culturally diverse city in the UK, more than London.
Wow,
yeah.
okay.
So having an awareness of things and of people is really important, and I think off the back of that is something that's really interesting that more actually I learned in my dissertation, but we can give, or we as paras can't, but doctors on the road can give blood to people who need blood if they need it on the side of the road. But Jehovah's Witnesses can't have blood because then they're not pure. So it's having that awareness, and then it's kind of working in the patient's best interest and things like that. So having an awareness of that on the job I personally think is quite important, because you have to think of the secondary outcomes to them, not just there on the side of the road. Kind of thing.
Okay. All right. Where would you like to see yourself in 5 years?
I would like to have potentially gone and got potentially a master's degree, so that's like furthering my degree, and with that potentially do something called a CCP, which is critical care paramedic. So we then specialise in solo working, so we work on the cars, so like a rapid response vehicle, RRV, on your own, and you're going to really, really serious things, usually getting there first, and lots of the really quick thinking stuff. So quite like to be a CCP, critical care paramedic.
Would that be much more stressful, I'd imagine?
It could be, yeah, it could be.
Okay.
But obviously with the confidence that you gain over the time. If I didn't do that, then I'd do an ACP, which is like an advanced care practitioner, where I would go back to university and do my prescribing course, so I can then administer lots of different drugs and prescribe lots of different drugs to people on top of what I can do now.
Is that important as a paramedic to be able to give
so
drugs?
I would then be working in a GP surgery, in a doctor's surgery,
okay.
so taking the strain off GPs, so you could make an appointment to see a GP and you'd either see an advanced care paramedic or a doctor, which I potentially would do because it's a little bit less shift work and no nights.
Right, I see. Okay, good. All right then. you're obviously still quite young now, but if you were to start your life over again, what would you do differently?
I'd probably muck about a little bit less at school. I was a little bit too chatty, not brilliant with kind of getting down to it. So I potentially would redo school and set better boundaries for work and play.
Some very
possibly.
wise words. Very wise words.
Yeah, because I think it would make life a little bit easier, even if it doesn't seem fun at the time. It would make life much easier later on, I think. That would probably be my advice. Or not my advice, that's what I would do differently. What else would I do differently? I'm not sure. I don't know. I'd like to learn, I would like to have started a language earlier.
Yes, yeah, I think language learning
I'd
definitely
like to
helps.
have learnt a language much earlier on and followed it all the way through so I could speak it fluently now.
Well, we've also briefly mentioned about travelling. And you say you're not really a kind of person that enjoys travelling.
No, I lack the confidence to travel.
See, that's very interesting. Yeah, given your job.
Yeah.
Wow.
Yeah.
Okay. Can you tell me what is your goal in life at the moment? What's currently on the horizon as a goal, something you want to achieve?
I would like to...
you want to buy a house? Or...
Oh, yeah, no, I'd love to buy a house. That is probably my biggest goal at the moment. Yeah. I'd like to buy a house.
What kind of house would you buy?
I'd like to just buy a nice little first house, if that's even a thing in England.
Okay.
Definitely.
Ladder.
I'd like to get on the property ladder, carry on working up as far as I can really go with work, and still being good at it, of course, like not just rushing it.
Yeah.
And yeah, carrying on with doing exercise, keeping happy.
Because you like doing a lot of sport.
Yeah, I like sport. I like running, triathlons and things like that. So.
Goodness me, well-rounded.
Yeah.
I'd imagine also the sport also helps with the stress.
Yes, absolutely, the sport, and that's what people will say, and that's for any walk of life. That's not just
us. I agree. Yeah,
definitely.
All right, last question for you then, Kate. Please, can you offer some of your best life advice in one sentence?
Have fun, be kind, and always do your best. It's probably what I'd say. And then things will fall into place after that, I think, if you're kind and having fun. If you're happy, other people will be happy.
Right. Excellent. Good. Sound words. Excellent advice. Thank you very much.
You're welcome.
Okay, and as always, keep listening. Have fun to learn English. If you don't have fun, you won't learn. Take care. Bye-bye.